Good afternoon, everyone. We're going to get started in just another minute. We want to welcome you to this informational webinar on Medicare and open enrollment period that is currently ongoing. If you have any questions, you can put them in the chat. My name is Tracee Garner, and we'll get started in just another minute, and we will take questions at the end. Please turn on the captions if you would like to see the captioning for this session. All right, out of respect for everyone's time, I want to welcome you to the informational webinar for Medicare and the open enrollment period. Today we have Mr. Patrick M. Hamilton. He is a special assistant to the Office of Operations and Local Engagement for the Centers for Medicare and Medicaid Services. And we have his colleague, Miss Angela Cain, sorry. She's the Outreach and Engagement Specialist. Also, they are both for the local engagement and administration. They are both located in the Philadelphia office, and we are so happy to have them joining us to tell us all about this. The Independence Center of Northern Virginia, where I'm from, my name is Tracee Garner, and I will be helping to facilitate, but they will be leading the session. Again, we're going to take questions at the end, and of course, there'll be a number of information to share with others if you need, and we will probably place the recording on the ECNV website, and we'll send out a note how to access that in another day, probably tomorrow, when the session wraps up. Thanks everyone for being here, and thank you so much, Patrick and Angela.
Great. Thank you, Tracee. Thank you for having us. And thank you all for joining us today for this intimate conversation that we're going to have today on Medicare Open Enrollment. As Tracee said, my name is Patrick Hamilton, and I'm a special assistant and outreach specialist in the Philadelphia office of CMS. CMS is the agency in the Department of Health and Human Services that has responsibility for administering the Medicare, the Medicaid, and the Marketplace programs. So the three big ones. We serve more than 160 million Americans directly. And the work that Angela and I do in the Philadelphia office is basically doing stuff like this, coming out and speaking with folks who may need information about our programs. Now, I will tell you that Tracee and I started this conversation way back in September, but then you may have remembered that there was a government furlough when the government shut down, and Angela and I were not able to do really any of our work while the government was shut down. Unfortunately, what that means is that Medicare Open Enrollment, which started on October 15th, actually ends this coming Sunday, December 7th. So what we wanted to do when we got back from furlough is to reach out to all of our community partners, including independents. And we wanted to say, hey, we would like to have the opportunity to speak with folks who are on Medicare who may need to have some information so that they know what they need to do in order to make any necessary changes to their enrollment, Medicare enrollment that would go into effect, excuse me, on January 1st of 2026. Again, this is very last minute because we lost so much time during the shutdown, but we want to make sure that we take every opportunity that we can to make sure that we're going out, we're talking with people in Medicare between now and the 7th. So that is the reasoning for this late date. So let's go ahead and get started with our conversation. When we go out and talk to any audience, we always give this disclaimer. I'm just going to basically read this almost verbatim. The information that's in the slide deck is current at the time of the presentation today, but of course, Medicare policy is subject to change. The contents of the slide deck don't have the force and effect of law, and they are not meant to bind the public in any way unless it's specifically incorporated into a contract. The slide deck is intended only to provide clarity to the public regarding existing requirements under the law, but again, it's not the law. And the slide deck was printed, published, and produced at the U.S. taxpayer expense. So we're going to go ahead and get started, and we're going to give a very, very general, broad overview of Medicare coverage, what is covered at a very, very high level, and basically the two main ways that you can get Medicare coverage. And if you are on Medicare right now, you probably already know this, but this is important to kind of set the table for open enrollment and talking about what you need to do during the open enrollment period. So there are two ways that you can get Medicare. One is called original Medicare. So that is when you turn 65 and you get your red, white, and blue card in the mail. Generally, most people will have Part A at no cost to them because they paid into the Medicare tax throughout their working careers, and then also Part B. Medicare Part A is your hospital and inpatient coverage. Part B is basically your outpatient and your doctor's visits, and also durable medical equipment. With original Medicare, any doctor who or any hospital that accepts Medicare, you can go and you can see that doctor or or get treated in that hospital. When we talk about Medicare Advantage in a minute, we'll be talking about networks. But that is not the case under original Medicare. Any doctor, any hospital that accepts Medicare, you can go and you can see that doctor if you have original Medicare. Now, in addition to Part A, which is the hospital inpatient stuff, and Part B, which is the outpatient or doctor's visits, most people also elect to get a Part D plan, and that's for prescription drugs. And that's a standalone plan that is in addition to your traditional Medicare. And there is usually a monthly premium that is associated with the Part D plan. And they are run by independent commercial plans. So Aetna, Humana, those types of plans, they also set up Medicare Part D standalone plans. Drug coverage is not automatic. You have to join a standalone Part D plan when you become eligible to do so. So for those who do not have original Medicare, and it's about 50-50, it fluctuates around the 50% mark as to the percentage of people with Medicare who are on original Medicare and those who opt into what's called a Medicare Advantage plan. Sometimes you might hear it called Part C. These plans are offered by Medicare approved private insurers. And what Medicare Advantage plans do is generally bundle all of the services that you get under Part A, Part B, and Part D into one plan, or into one program. Plans often include additional benefits that original Medicare will not cover, such as routine dental, vision, and hearing services, although not all of them do, but many of them do. In original Medicare, they are not covered. So one of the benefits of Medicare Advantage is you may get some additional coverages. But as I mentioned earlier, most plans require you to use doctors that are in the plan's network. So you always have to make sure that the doctors that you are going to, or the doctors that maybe you're being referred to, are part of the Advantage Plans network if you so choose to sign up for Medicare Advantage. What is Medicare's open enrollment period? That is the period that we are in now. I mentioned that it started on October 15th and it ends this coming Sunday on December 7th. And those are the dates every year. It's always October 15th to December 7th, regardless of the days of the week that it happens to fall in a given year. And this is the time that you can make certain changes to your health insurance coverage, including adding, dropping, or changing your Medicare Advantage or that Part D standalone plan that I talked about. Open enrollments for everybody with Medicare. So regardless if you aged into Medicare when you turned 65, if you are under 65 but qualify for Medicare through a disability, or if you have end-stage renal disease. So everybody who is in Medicare, regardless of the door that they came in through, they have this opportunity to make those changes. Even if you are happy with your current coverage or your drug coverage, it's still a really good time to review your documentation, and we'll talk about what that documentation is to make sure that there aren't any changes that are on the horizon that may necessitate you to review your coverage options and to make changes. Why December 7th is so important is that if you do not make any changes by December 7th, you may have to wait until the next open enrollment period in order to make changes. So we're going to talk about why that is very important. So I mentioned some of the documentation that you should be on the lookout for. One is called your ANOC, or Annual Notice of Change. Some plans may call it your evidence of coverage. So any of those documents, if you saw that they arrived in the mail, you definitely want to pay attention to them. You should have received them by the beginning of October. And these are the documents that you're going to review for any changes, such as the costs for the coming year, the plan's benefits and coverage rules, and the formulary. Formulary is the list of drugs that a plan will cover. And that is critical because if you know that you're going to be on a certain medication, of course you want to make sure that your plan is going to continue in the next plan year, starting in 2026. If you're unhappy with any of your plan's changes or your plan's performances because they all get a star rating, then you can enroll in a new plan during the open enrollment period. And we're going to give you resources as to how you can go about to affect that change. So what can you exactly do during open enrollment? So you can make as many changes as you want to. So let's say we were a little bit earlier in open enrollment period and it was October 20th and you talked to somebody and they said, I think this Aetna plan is great for you. You can go in, you can make those changes. November 1st rolls around, you have a conversation with another family member. Oh, I think Humana works best for you. You can go in and make those changes. You can do that as many times as you want to before December 7th, but whatever the last change that you make on December 7th is the plan that you will be in starting January 1st of 2026. And also depending on where you live, if you do not opt into a Medicare Advantage plan, we're going to talk about something called Medigap or supplemental insurance, and you may be have the opportunity to participate in that as well. This is really important. So we always give a list of questions and things that you want to consider if you're going to decide for a Medicare Advantage plan. So these are some of the questions that you want to ask yourself. How much are your premiums? Of course, everyone probably the first thing that they're going to take into consideration is the cost, but it's important to realize that maybe a lower monthly premium may not be the best option for you because that could mean higher deductibles or higher other out-of-pocket costs. You want to see how much are your services going to be? How much do you have to pay for hospital stays? Is there a yearly limit on what you can pay out of pocket for medical services? And make sure that you understand that rules or any coverage rules that could affect any type of coverage that you may already have, such as a retiree employer plan, for example. Does the plan include Medicare drug coverage? So most of the Medicare Advantage plans will have drug coverage that's bundled into it, but they all do not necessarily. Most of them do, but not all of them. So you always want to make sure that drugs are included, especially if you're taking a number of prescriptions. Plans must cover all medically necessary services that original or traditional Medicare coverage covers. In many cases, you may need to get approval from your plan before it covers certain services or supplies. Does the plan also offer extra benefits that original Medicare doesn't? Like we mentioned earlier, vision, dental, and hearing services. Do the doctors that you were seeing, do they accept coverage? Are they part of the network? Are they accepting new patients? Very important to consider. Do you have to choose your hospital and healthcare providers from a network, or do you have to get referrals? That's also a big consideration as well. And as I mentioned, will this plan affect any additional coverage that you have through other sources? So when we're talking about the Part D standalone plans, and again, these are drug coverage, drug plans for people that stay in original Medicare. There's also things that you need to consider. For example, does the plan cover all the medications I take? That's probably the first question that you're going to ask. Are there restrictions? There are a number of restrictions that plans do and can put into place, such as prior authorization, step therapy, and quantity limits. Prior authorization means basically that you have to get approval before the plan is going to cover a particular drug, and that could take, some time. Step therapy means the plan may want you to try a cheaper or a generic version of a more expensive drug to see if that's going to work before they would approve that more expensive drug. And then quantity limits. Do they restrict the number of pills that you can get in a specific time frame, such as 30 pills of drug X per month? You also want to ask how much am I going to pay for the monthly premiums and the annual deductibles? And also how are we going to pay at the pharmacy at the actual point of sale? And again, a lower monthly premium is not always the best option. You also want to look at deductibles and other out-of-pocket expenses. The pharmacy that you go to and that you're comfortable with and familiar with, is that part of the plan's preferred network? Because again, we're talking about networks as well. All right, so I mentioned Medigap. Medigap, as the name would imply, the official name is Medicare Supplemental or Supplement Insurance. It is basically an insurance policy that fills in the gap of what original Medicare will not cover. Generally speaking, for people that are in original Medicare, Medicare will pay for 80%, basically 80% of all services, leaving 20% of out-of-pocket costs to the beneficiary. What Medigap policies are, they are private companies that sell policies that basically, as I mentioned, fill in the gaps for things such as co-payments, co-insurance, and deductibles. So Medigap policies also cover benefits that original Medicare doesn't cover, like emergency foreign travel expenses, but they do not cover your share of expenses under other types of health coverage. So, for example, you cannot get a Medigap to pay for anything out of pocket on the Medicare Advantage. The same thing for standalone Medicare drug plans, as Part D plans that we talked about, excuse me. Any employer or union group health plan, retiree plan that you have, Medigap will not fill in those gaps, and also Medicaid or TRICARE. So this is strictly for people with original Medicare to cover that 20% of out-of-pocket costs. All Medigap policies must follow federal and state laws designed to protect you and must be clearly identified as Medicare supplement insurance. Now, these plans are standardized, which means that they fall under a category lettered A through N, and each standardized Medigap policy under the same plan letter have to offer the same benefits. And if we were doing a deeper dive into Medigap, we would be sharing with you charts and graphs and tables that show you A through N and then all the services that are covered so you can see exactly which type of Medigap policy best suits your needs. Basically, everything that's in the same letter, for example, all of the F plans, for example, they all cover the same thing. The only difference would be price, so competition in the free market there. So we also have some decision points for Medigap policies. So for example, we would say, are you on original Medicare? Because it only works with original Medicare. And hopefully if we ask that question, you would say yes, because I've repeated it a couple of times. What if I have other supplemental coverage like from an employer? Again, we said you will not need a Medigap because most likely it would not qualify for what would need to be covered. Now, if you can afford Medicare deductibles and co-payments, for example, maybe you don't go to the doctor very often, or you don't have high other costs, then what you would do is you would weigh the amount that you are spending out of pocket for your deductibles and co-payments with what the monthly premium for the Medigap policy would be, because there is a monthly premium for Medigap policy. So you would have to do a cost benefit analysis. And you would ask, what does the Medigap premium cost? And that's going to vary. And as I mentioned, for all of the standardized plans under each letter, the coverage is the same, but the premiums will vary from plan to plan. So we always tell people your first stop place of shopping should be Medicare.gov. Medicare.gov over the past couple of years has gone through a number of enhancements that I think have made it finally very user-friendly so that people with Medicare or their caretakers, their families, their loved ones can go on and you can actually do a side-by-side comparison of both those Medicare Advantage plans that I talked about and the prescription drug plans, the standalone plans. You can put in the listing of the prescriptions that you're taking so that you're only looking at plans that are in your area that are going to cover the drugs that you need. You also, starting, I believe this year, you can also put in your names of doctors and other facilities, so that when you're doing that network search, so you can see if your providers are in a network, you'll be looking at plans that are going to accept the providers that you are seeing. So Medicare.gov is the first stop shopping for all of that. And we always tell people that if you're happy with your coverage right now, and if you look at that annual notice of change, and if you see that the changes, if there are changes, aren't going to affect your coverage, then you don't have to do anything. Then your coverage will roll over to the next year. You do not have to proactively go onto the website and say, hey, I want to keep my coverage. If you do nothing, then the plan that you have will continue to be that plan. The only time that's not the case is that if a plan decides that they are no longer going to participate in the Medicare Advantage program, and again, that's another presentation because there's a time frame by which a plan has to make that decision, and then they have to inform their customers, and there's a little bit more that's involved with that. But generally speaking, if you're happy with your coverage, and your plan's going to continue for next year, you don't have to do anything in order to move on. This is important. Why compare plans on Medicare.gov? And one of the questions and one of the things that we've been tackling over the past several years are those pesky TV commercials. So when you see the TV commercials with William Shatner and JJ Jimmy Walker from Good Times and Joe Namath and who else? All those commercials, the woman who yells at her husband, they are not necessarily the unbiased resources that Medicare.gov is. They're all affiliated with agents or brokers that are getting a commission to steer you into one or another plan. Medicare.gov is unbiased. So you go in there and the only thing that you are being asked is, what are your health needs? What are the prescriptions that you're taking? Who are the doctors that you're seeing? And the information that is given to you from Medicare.gov is not under any type of trying to get a commission to go to one particular plan over another. So that's why it's very important that Medicare.gov is your first stop shopping for those updates. And as I mentioned, for the first time, you can look up which plans cover your favorite doctors and providers. So this is the first time. So before, we always had the capability to put your your prescription drugs in and to compare plans just based on your prescription drug usage. But now you can put your doctors and providers in, which is very important. Also, we've made some upgrades as it relates to the ease with which people can get into their account. We have some pass keys. There is Face ID that's available for people that are technically savvy. I know my mom, for example, she lives on her iPad, and I taught her how to get into her plan, or I'm sorry, into her Medicare.gov profile. You can also go into Medicare.gov and you can assign a representative. So she assigned me as her representative, so I can go in and I can help her make choices. So that is very important updates for 2025. So with that, I'm going to turn it over to Angela, who is my colleague in the Philadelphia office, and she's going to start talking about the Medicare Savings Program, which is a very important program that will save you money on your Part A and Part B coverage. Angela, take it away.
Thank you, Patrick. Hello, everyone. It's great to be here. Thank you for having me. I'm an outreach specialist for the Local Engagement and Administration Office. I work with Patrick, and I'm going to pick up here with Medicare Savings Programs. So, people may be eligible for the Medicare Savings Program or MSP. Um, the program is for people with limited incomes and resources. And the MSP program can help eligible individuals pay for their Medicare premiums and other costs associated with Medicare, such as their deductibles, coinsurance, and co-payments. So, how do people get it? They would have to go through the state. There is, every state has an MSP office, and Patrick did put the Virginia state office information on this slide deck. And then the state would, after you apply, the state would determine which MSP program would be most appropriate. So there are four different kinds. One is called what we call the QIMBY, Qualified Medicare Beneficiary Program, and it pays for Part A and Part B premiums. And Medicare providers aren't allowed to bill you for services and items that Medicare covers, including deductibles, coinsurance, and copayments, and shouldn't be billed. And then there is the specified low-income Medicare beneficiary, SLMB, SLMB. It pays for Part B premiums only. And then we have the Qualifying Individual Program, or QI. It helps pay Part B premiums only. And a person would have to apply for it each year. And then the Qualified Disabled and Working Individuals, QDWI program. Now, this one pays for Part A premiums only, and a person may qualify if they have a disability and working and lost their Social Security disability. So that's pretty specific. Next slide, please. So this slide talks about the extra help, which is a Part D prescription, also known as a prescription drug, low income subsidy, and it helps with, as it says on the screen, with the premium is a zero premium, zero deductibles, and other benefits. Next slide, please. And this slide talks about the maximum that a person could have in their income or resources as a single person or as a married couple. Then there are some exceptions where people could make more than what's shown here. Next slide, please. So for 2026, the extra help co-payments are described on this slide. So for a full subsidy, full benefit, dual eligible, institutionalized beneficiaries and beneficiaries receiving home and community-based services, they would pay zero. And then bullet 2 mentions the maximum co-payments for non-institutionalized beneficiaries. Next slide, please. So people can qualify for extra help, which is, as I mentioned earlier, low income subsidy for prescription drug benefits. They can automatically qualify for it, or if they don't, then they can apply for it. So these are the qualifications for automatically qualifying. A dual eligible, that's a person with Medicare and Medicaid, or if the person has supplemental security income, or they're receiving help from Medicaid to pay for their Part B. And then if they don't qualify, then they can actually apply going to Social Security or the state medical assistance office or the Medicaid office or their state health insurance assistance program. And we will have the information for that office at the end of the slide deck. Next slide, please. So we're going to talk a little bit about what's new in coming in 2026. So there, first of all, it talks about the 10 new brand name prescription drugs that will be up for, or that are up for negotiation of their price. And this enables people to And um, and then we have the $2,100 limit on out-of-pocket drug costs for people with Medicare. For Part D, prescription drug coverage, it's currently at $2,000 cap. But once you meet that cap, then the beneficiary doesn't have to pay anything else. So it did go up $100 for 2026. Then we have the expanded screening for colorectal cancer. And then we have the patient-focused service to help people manage health needs. And this is the advanced primary care management services. And we're going to talk a little more about that on the next slide. Next slide, please. So this is a new service that Medicare is covering. It helps to manage health needs. So the providers who offer these services will be taking extra steps to actively manage all of a person's healthcare needs. And this is going to be a 24/7 care team access, providing comprehensive care management, medication management, and it shows where you can go online to learn more information about it. Thank you. Next slide, please. So we also, for 2026, we want to talk about telehealth, which has been a lifesaver, especially during COVID. So through January 30th, Medicare is still covering telehealth services that you can get from anywhere in the United States, including your home, if you have Medicare. And however, starting January 31st, a beneficiary must live in a rural area and go to an office or medical facility that's also in a rural area in the U.S. for most telehealth services. And then if you're not in a rural area or healthcare setting, you can still get certain Medicare telehealth services on or after July 31st, like the monthly end-stage renal disease visits from home dialysis, services for diagnosis, evaluation, or treatment of symptoms of an acute stroke, and services for the diagnosis, evaluation, or treatment of a mental and or behavioral health disorder. And then some Medicare Advantage plans and some providers in original Medicare may offer more telehealth benefits than the basic coverage in original Medicare. Next slide, please. So we wanted to go over the Medicare costs for 2026. So this slide shows us the cost for Part A, or hospital coverage. So the actual dollar amounts are updated yearly, and you can go to the website. Is it shown here? No. Medicare.gov/basics/costs/Medicare-costs to get the most up to date. This is what you pay per benefit period. And for Part A, covered medically necessary services. So this would be hospital inpatient stay, and then mental health inpatient stay. Next slide, please. So this one is a continuation. It's showing the skilled nursing facility care costs for days 1 through 20 is 0 for each benefit period. And then it shows home health services, hospice care, and blood. Next slide, please. Here we talk about the Medicare Part B monthly premiums. The monthly Part B premium will be deducted from your Social Security benefit payment If your Social Security benefits aren't enough to cover the whole Part B premium, or you're no longer getting Social Security benefits, you'll get a bill for your Part B premium every 3 months. And Part B covers most outpatient and certain vaccines, but mostly outpatient. Do you want to add anything for what Part B covers, Patrick?
Part B also covers durable medical equipment. I don't know if you mentioned that.
Yes,
Okay.
thank you. Yeah. No, I did not. Thank you. Knew I was forgetting something. Okay, the monthly Part B standard premium is the $202.90 for 2026. And then some people with Medicare pay less than the full Part B standard monthly premium due to the statutory hold harmless provision. This provision limits an increase in their Part B premium to be no greater than the increase in their Social Security benefits. And then we want to mention that your premium may be higher if you didn't sign up for Part B when you first became eligible for it. The cost of Part B may go up 10% for each 12-month period that you could have had Part B but didn't sign up for it. So, in most cases, if you don't sign up for Part B when you're first eligible, you may have a delay in getting Medicare coverage in the future, and you may have to pay a late enrollment penalty for as long as you have Part B. Next slide, please. Okay, what you pay in original Medicare continuation of Part B. So in addition to the premiums, there are other costs you may pay in original Medicare. This is what you pay in 2026 for Part B covered medically necessary services, which are services or supplies you need to diagnose or treat your medical condition and that meet accepted standards of medical practice. Next slide, please. And then this is very important. We are making it's like a major initiative for our new administration. Well, it's not so new anymore, but we're focusing on fraud prevention. So this is a slide. It's called Beware of Marketing Fraud. So during open enrollment, there is a higher risk than usual for fraudulent activities. Medicare.gov and 1-800-Medicare are the official sources of Medicare information. Medicare has rules about how plans can and cannot communicate with you during this open enrollment period for their marketing, for marketing their insurance products. So knowing how to protect themselves, the beneficiaries from detect and report marketing violations can help save both you and Medicare money. So plans are allowed to send you emails and or direct mailings, but they are not allowed to call you or visit you in person to market their products without your permission. It's important to remember that Medicare will never call you. If someone you don't know calls you about Medicare, please hang up. Plans who send emails must provide an opt-out option for people who no longer wish to receive them. And then we're asking beneficiaries before they enroll in a plan to make sure they understand what the plan covers, how it affects your Medicare benefits and other health benefits, like Medicaid or your retiree or union coverage, and whether it covers the drugs you need. And then we're asking people, to contact their plan directly to confirm it will cover certain services and make sure that you get everything in writing. And then we want to add that an agent or broker should never pressure you to join a plan. And one other thing is that we want to make sure beneficiaries should make sure that their provider, their doctor, is in the network for Medicare Advantage. Patrick mentioned that earlier, because plans do change every year. Next slide, please. Oh, I think I should be handing this over to you, Patrick.
No, you're
I'm
doing a
real
great
fast.
job. I'm gonna let you keep going. Now we're going
Thank
to
you.
start with just a few more, a few reminders. Again, Medicare.gov/account. If you don't have a Medicare.gov and My Medicare account, go and do it today. It's very easy to set up. And as I mentioned, you can assign a representative to also have access to your account. You can opt to get your Medicare and You handbook electronically, your Medicare summary notices electronically. And again, during this critical time, if you want to make changes through the open enrollment process, you can do that as well. There's no need to wait anymore for Medicare summary notices. Now I believe that they're only, if I believe right, only printed out quarterly or maybe even just every 6 months now. But now, if you sign up digitally, any month that you have a Medicare service, there will be an MSN that will be electronically generated and sent to you in your secure portal email thing that is in your My Medicare account. So you will be able to get your MSNs more frequently than if you rely on the paper mailing. If you decide, hey, you know what? I like to have my notices, the paper notices. That's fine. You can always opt back into those paper notices. I mentioned the Medicare and You handbook, always available at Medicare.gov. It's, I believe, always going to be published electronically generally before you're going to receive it in the mail, so probably sometime late summer, early fall. Again, I call that the Medicare Bible. So all of your coverage options or all of your coverage policies, everything that's covered in Medicare is basically in that book. You can again opt back into the paper book if you like to have a book in your hand and actually go through the pages. I get that. Folks still like to do that. That option is still there. What's great about the Medicare and You handbook electronically is that they are still broken down by state so that you will get state-specific plan information for both Medicare Advantage and Part D plans when it comes time to make those changes. Excuse me. We also, as I mentioned earlier, starting this year, you can find Medicare providers, and if they are part of the networks of the plans that you belong to, you can also get their ratings. There is a Care Compare website that gives ratings not only to providers, but also to hospitals, nursing homes, you name it. There is a rating system for it, and we just call it the Compare. So we have the nursing home compare, the hospital compare, and that's the way that you can another thing that you can use when you're doing your Medicare shopping, shall we say. We've said this 100 times. The two biggest resources, Medicare.gov and 1-800-Medicare, all are available 24 hours a day, including the phone number, including weekends. And they can actually sit with you on the phone and they can do those plan comparisons with you if you are not someone who is privy to using a computer or have a family member that will be able to help you with that. Angela mentioned the State Health Insurance Assistance Program, or the SHIP in the Commonwealth of Virginia. It is VICAP, which is the Virginia Insurance Counseling and Assistance Program, one of our most trusted partners in Virginia. So they give free of charge help with to people with Medicare, their family members, their caregivers, so that they can make the informed choices that they need to make moving forward. Their phone number and their website are also on the slide as well. All right, so we're at the conclusion of our presentation. We're going to open up for time. We have time for a few questions. We will try to answer those questions. We do a very good job at saying that's a great question. We don't know. We'll take it back. We'll make sure that we either get your contact information or we'll work directly with Tracee to follow up if need be. One thing that we do ask, if you could take a second, we like to get feedback on these presentations that we do so that we can ensure that we are giving you the information that you need. So there are two ways that you could do that, and it's only a 7-question survey, and I believe that it's even just like a drop down, or you don't even have to really type anything in if you don't want to. If you are using your phone, you can flash your phone at that code on the right-hand side of the screen, and that'll take you directly into the survey on your phone, or you can use the website down at the bottom of the screen. So if you can do that, we would be most appreciative of your feedback. I'm going to hold this screen up for a few minutes while we wrap up. I will also share with you at the very end our contact information. So both for myself and for Angela. So just in case you have some really fantastic questions after we part ways today, then you will be able to get in touch with us directly. So I'm just going to hold this for another second. And then I'm going to put up the slide that has our contact information. And then Tracee, while we do that, we can see if there are any questions that Angela and I can try to answer.
Sure, and I believe that I've put the correct, it was a long link, so I tried to put it in the chat. But anyone who has questions, we have a question from Lelena. You can come off mute and pose your question if you don't mind, or you can put it in the chat for anyone. Go ahead, Lelena.
Okay, thank you. Thank you for the presentation. My question is, I have one consumer that I was assisting, and he's 80 years old, and he did not enroll in Medicaid on time. So I guess he pays penalty, like on top of the premium, he pays a penalty fee. When we called Medicaid, that's when we
The late
figured.
enrollment fee. So
Yes.
can I
So
just
is
stop
there
you for one
yeah,
second? You said Medicaid, but I want to make sure that we're talking about Medicare.
okay. Oh, so I wasn't
No, I
sure if
want
it
to
was
make sure.
Medicare or Medicaid. But yeah. So I wasn't sure if it was Medicaid or Medicare.
Okay, so and you said he is 80 years old, 80.
Yes, but he retired when he was 62
Okay.
or 60.
And did when he okay, wow, so it's going back. It's quite a ways. When he retired, did he have retiree health group insurance?
He did not.
He did not. And he did not enroll in Medicare when he was first eligible when he turned 65.
Yes.
Okay. So yeah, unfortunately, as Angela mentioned, for every 12-month period that he should have or could have been enrolled in Medicare and opted not to, then there is a 10% per year penalty. So if 65 from 80 is what, 15 years? So
Yeah.
the 15 or 20, yeah. So yeah, so whatever the Part B premium is, he would be paying a 150% penalty.
So the Q1B does not cover the penalty fee.
Does what not cover the penalty fee?
The Q1B, if because he is a
Oh,
low
Quimby.
income.
Is
Yeah,
he
Quimby.
okay?
Oh,
So he is in the Quimby program.
yes.
Okay, that is a good question. Does Quimby cover the late fee?
Mm-hmm.
Um, that is an excellent question, and and I don't know, Angela, if you know that off the top of your head, but I don't recall getting that question. But it's something that is it's going to be critical for him. So we definitely want to make sure that we get that information.
Yeah, I think people who qualify for Quimby wouldn't have to pay the penalty, but I think the question would be, when did he qualify for the SMP program? Um, so that would be definitely an individual. So do you have an SSA contact for the gentleman?
Sorry, what is an SSA?
Oh, Social Security
Oh,
Administration.
I'm sorry, you said
They're our
okay,
partners.
social no, we don't have a contact.
Okay.
So,
Maybe
Alana,
we
would it be
could, yeah.
possible? Would it be possible if you could send Tracee your contact information because this is something we want to. We may have to get some specifics for this gentleman's case, uh, based on, like Angela said, when he qualified for the Quimby program, what his exact retirement date. We just might have to. I don't want to give a generic answer because there may be a little bit of nuance here. So I
Okay.
want to make sure that we capture everything.
Okay, I'll get in touch with the consumer as well because this he reached out probably a few months ago, so I'll
Yeah.
you know get back to him and yeah, I'll definitely do that. Thank you.
Leilana, let me ask you a
Yeah.
follow-up question. Was he aware of the late enrollment penalty when he reached out to you?
He thought that was his regular premium, and I knew that's not it. But he is always short in cash, so and he doesn't speak English well.
Okay.
And I'm originally from Ethiopia, and he's the same way Ethiopian. So
Okay.
he didn't know what he's qualified and what he's not. So that's how I
Okay.
got in touch with him.
Okay.
Yeah,
I'll
I
put
Yeah,
you
just
we
had
guys
will.
in touch in the future. After the call, I'll send an email to you both.
Thank you.
Go ahead, Angela. I'm sorry.
just wanted to mention that SSA is our partner. They actually, a very important partner. They handle all eligibility and enrollment for Medicare.
Oh,
And once they take care of that part, they calculate, you have to have worked 40 quarters, which is equal to 10 years, and have paid that FICA tax towards Medicare.
mhm.
And then you qualify for Medicaid. But Medicaid, you don't have to work any quarters or pay taxes. That's based on a need. That's like a needs base, based on your income uh, and what is it, assets.
Yeah.
But yeah, so SSA would handle that, and we may have to get you connected with our Virginia contact person in SSA. Thank you. That's all I wanted to say.
Thank you so much.
A
You're welcome.
Virginia contact person for SSA would be great for all of us. We all, they're
Yes.
hiding and we don't know where they are, and we don't
Yes.
like to give
Yes.
their name and phone number, direct phone number. I have another question, and this person desires to be anonymous. It says that they received information and a card from Humana stating that they are being moved to Part D. The question is, they thought they only had Part A and B from Medicare and nothing for Part D. Do they have to have Part D? Is it
So
not
you
an
do not.
option, or they, yeah.
Yeah. So you do not have to have Part D. Part D is voluntary. Um, so if you got something from, so they got something from Humana saying that they were being moved into Part D.
Mm-hmm.
Well,
So,
Humana is a Medicare. Oh, go ahead.
well,
Is
yeah.
that a
So you
Medicare
mentioned
Advantage
Medicare
plan?
Advantage, and it's
Mhm.
also a stand. Yeah. So Humana has both Medicare Advantage, that bundled Medicare Advantage plus we
Mhm.
talked about, and they also do Medicare Part D standalone plans. And this would be something, again, we would have to have somebody actually look at the record because it sounds like, and I don't know if this person can post any follow-up, were they in some type of Medicare Advantage plan uh, prior to this, and they're now in original Medicare?
They
Because
were
they would
in
be,
Part A and B for Medicare
okay, because
and
they
not
wouldn't be,
Part D.
they would not be moved into a Part D plan uh, outside of their own doing. So they wouldn't be automatically moved into a plan if they chose not to. Part D is optional. What we tell people is that when you become eligible for Part D, you should enroll, even if you enroll in a low premium plan, because much like the gentleman in the last example, there is a late enrollment penalty if you don't enroll in Part D and you wait until whenever you do. But to say that they got something from the plan saying they're being moved into Part D, I would want to look at that person's record to see exactly what's going on. So that might be another one that Tracee, we would have to reach back out.
Okay.
Because that if somebody is not involuntarily moved into a Part D plan, if they were never in another, especially in another Humana product.
Okay, great. All right. Actually, Wendy, do you want to follow up? She's raising her hand.
Yes. Thank you for answering those questions. I'm sorry, I just don't like um, just Zoom calls and speaking into different things. But that was a question from me.
Okay.
We're guardians over an individual who's 44, well, 45 now.
Mhm.
Um, no blood association. He comes from a horrible background, and we were asked if we could take him in. So we did. And we don't know much history because there's not too many people left in his family.
Mhm.
But he has the red, white, and blue card.
Okay.
I believe he only had Part A and Part B. We've only been guardians for the last year. He's been with us for 2 years. And all of a sudden, out of the blue, I'm getting paperwork from the Department of Health and Human Services saying that Medicare is moving you to Part D drug plan for 2026. And they already sent a card from Humana, and he can't ask for anything because of the rights that have been removed because he needs help in decisions. And we never asked for anything. So I'm really confused why we're getting this and why, because I know past experience from my nephew who has special needs. Once they force you into Part D, it is hard to get out of it.
Mm-hmm. Okay.
And we don't want it. All we want is for this young man to be able to work because that's what he wants to do, and to get his DD waiver services, and then leave us alone. That's it. We'll take care of whatever else comes his way, because he doesn't make enough to survive on his own anyhow. So my husband and we supplement for his needs.
Mm-hmm.
But I don't understand. I don't know if it's a scam. I don't know if I'm supposed to call and say, hey, leave us alone. Why are you signing us up without being asked? Because when I heard that fraud statement from you guys, I'm like,
Mm-hmm.
is this fraud? They're not supposed to be pushing us anywhere. He does have Anthem. I'm sorry, Aetna. But
So he has Aetna for what?
we were told that you had to have that in order to get the DD waiver and to be able to get help with services for him. So we had to pick somebody, whether it was Blue Cross, Blue Shields, Medicaid information, or Aetna's information, or whatever the other companies are. We were
Right.
told that we had to pick one. So we did. But now we're getting all this stuff saying that Aetna's Medicare's choice is going up or something, and you're being moved into Humana.
Okay. If this might be a special needs program, it's SNP. Does that ring a bell? SNP, special needs
No,
program?
we
No?
haven't signed up for anything like that.
Okay.
We do the bare minimum. We try to. No offense to what all you guys do and the blessings that you do with helping people, but we try to, take care as much as possible without leaning on extra help.
Mm-hmm.
And so we try to
Understood.
the bare minimum.
Yeah. Wendy, so we're gonna have to talk offline because I'm probably going to ask if you can encrypt some stuff and send it because we're gonna have to. Angela and I can't go into the system to look to see what his coverage is right now, but we can put you in touch with the folks that can try to piece together what's going on and why you would have gotten that information from Humana. It's probably not a scam, only because they did contact you by mail, which is the way they're supposed to contact you.
Okay.
But without like just being able to put a couple more pieces of the puzzle together, I would want to chat offline.
I appreciate that because I keep trying to reach out to different people and they keep
Mhm.
pointing to this person, which then email that person, and then this person's supposed to call you back and they don't call you back. And
Right. Yeah,
so,
it's incredibly frustrating. I
yeah.
get it. I get it. Okay, so my address, I don't know if you can
Thanks.
see my screen, or if you can see the screen, our address is on there. So if you just want to jot that down or get in touch with Tracee and she'll make the connection for us, I'm sure.
Okay. Thank you.
Yeah.
Thank
And
you. Thank
Thank you so much.
I'd like to mention that there is also a late enrollment penalty for not having Part D prescription drug coverage too. So, and that information is in the Medicare New Handbook and online as well.
Which adds to the
Um,
frustration because I'm trying to take care of it without being outside the window, and I keep feeling
yeah,
like a dog chasing its tail.
yeah.
Mhm.
Now, Diana from SSA, her contact information was placed in the chat. I'm not sure. Was she on the call and she had to drop off? I'm
No,
not
no,
sure who
she's
put that
a
in there.
Marcus put that in there. She's a potential SSA
Okay.
contact, but he
Okay.
said it's as a last resort. So
Okay.
use with
Yeah.
caution. But thank you, Marcus. We have Letitia. She'd like to come on and ask a question. Go ahead, Letitia. Are you able to come off mute?
Can you hear me now?
Yep,
Yes.
we can hear you.
Okay, thank you so much. Thank you for doing this presentation. This has been really, really helpful. It just every year it has gotten more confusing that
Mhm.
what you're supposed to be doing, and you have you have all the different gaps and the different SNPs and everything. It's more confusing. So I, as a person who am older, was already having difficulties just kind of fielding through all of that. But I had a really serious, um, accident and some chronic illnesses as a result. And so I'm just really my biggest thing is to just ensure that I have insurance to cover everything because you know, um, I have medical supplies and medical devices that I have oxygen, so I couldn't get along without it. So I'm trying to do that. But this year I have gotten multiple things um, saying whole different things. So this one, for example, says that it says, and they came from different people. It's not just Medicare. For example, this one is saying that let me find the part about it. It says that basically they're taking out you know um, fees, but it out of my check, my Social Security check, mine is disability income, and I did work all the quarters and stuff, and as far as I know, I because of the injury I sustained, I wasn't behind on starting it or anything, but everything has been you know not fluctuating a great deal until the last couple of years, and this year in particular, like this letter was talking about that they were holding out $185 from this, and it says um, it doesn't really say what it's for. It just says if the deduction of past due premiums, like I think it is supposed to be for a premium for somebody. Now this was saying
Yeah,
like
I received.
before.
I'm sorry.
This was
I'm
saying
sorry to
before the
interrupt you,
enrollment period. Okay.
Leticia.
Yes.
Just to save time, I did receive this question earlier today, and basically, the premiums are going up, and I think this is a payment due to the increase in the premiums, and so they're going to automatically deduct a certain amount. The premium is for you for the
Mhm.
insurance. Some people who haven't previously paid will have to pay based on their income. Does that sound correct, Patrick or Angela?
Yeah, depending on if you're in one of those programs and if it's income based and if there was fluctuation in your income, that could be the cause for the increase. Just across the board in all insurance premium, and you probably saw this on the news that premiums are going up this coming year, and that's unfortunately even for Medicare in Medicare insurance premiums. Tracee, so was this the same particular question Letitia was asking? Is there something that we should be looking at, or do you think that the verbiage that she
Well,
is getting from her letter seems to be the issue that you're getting or that
it
you
is a
receive?
new, yeah, it's a new payment that's going to start probably in January, and it's taking some of the money that she's earning through her benefits. And so she's trying to figure out why this new payment,
Okay.
the $185, is going to be occurring. And I did answer briefly in the side conversation that we have is that they wanted to think about looking for other plans. However, all the plans, according to my knowledge, and you can correct me if I'm wrong, all of them are going to have a premium increase, I believe. So there's no guarantee
Yeah.
that if you switch plans, you'll automatically escape that premium. But go ahead,
Tracee,
Letitia. Yes.
Yes, mine has not experienced any kind of a change. If anything, mine would be less money. Not, I wouldn't have more income, so mine would be less money, and so
Mhm.
that's the whole thing I'm saying. I do think something odd because I have had several people tell me this with different plans and different things. But in my case, it doesn't even tell you if it's happening monthly or if it's happening for the year. It's a very vague letter. I mean, if it wasn't, if these letters weren't saying they were coming from like Medicare and Social Security and people
Wait,
like that,
Leticia, that's what I was going to ask you. Where, like, who sent you that particular letter?
this one is saying Social Security.
Okay.
And you understand, I thought they had to inform you, but this is saying that, like, you understand, we're in open enrollment now. So it's like they're taking something retroactively that was owing. And I think that's how many of the people, whenever I spoke to them also, I've talked to 3 or 4 different people recently, whenever this happened to me, and just trying to find somebody who knows. There used to be a lady that I knew who who was really helpful with that, and but she's no longer in her position. So I apologize.
No,
if you
no,
had
no, that's
shared it,
fine. It's good that you let us know. And if there, if it was, and it does happen, there is errant billing errors that happen on Social Security. We do have ways that we can refer those, and they can open up a case just to see if there's anything going on that shouldn't be. Um, so again, you have my contact information. So if you want to um, contact us after the call, we'll see if we can figure out
I
there's someone from Social
thank
Security
you.
who can take a look at it.
Yes, because another person I know, and they couldn't be watching this today, but another person I'm
Mhm.
familiar with, it's also a client of ECNB. They had a situation where they received a letter saying that their person who is their provider of their plan is no longer there, and that's who, if I had to change, I would change to, but they
Mhm.
just disappeared. Like Aetna just disappears one day. So
Yeah.
there's also been a lot of providers that have changed, and
Or
there's
leave
not the same
networks.
people.
Mhm.
Yeah, we unfortunately we hear that. We've been hearing that a lot the last 2 open enrollment periods, actually.
And even with
You-
my drug plan is has been the same thing for years. And normally I have a way to check it. I'm not really good at doing stuff on computer as well,
Mhm.
but it's also like the resources of people who know about things like you and Tracee are talking about are becoming more limited. I mean, there used to be kind of a plethora of people who knew what was going on, and everybody now that I would normally ask, they no longer are in their positions. They,
Right.
somewhere
Right.
between the pandemic and now, they are no longer there.
Right. Well, we'll certainly take a look and I'll connect you with Patrick and Angela. We're going to take just our final question for the day, if that's okay, if that's good for Patrick and Angela.
Mhm. We
If
have time
there
for one
aren't
more.
any, sorry.
I said we have time for one more. Yeah.
Yeah, yeah. It doesn't look like we have anybody. You can raise your
Okay.
hand or put it in the chat. But again, thank you both so much for your time and for all the invaluable information. And I'm sure a couple of people will be in touch with your contact information and
We'll be
the
waiting.
webinar. This, go ahead.
I said we'll be waiting for their emails.
Yeah, yeah, they're gonna send them. Don't worry.
Not a
All right,
shocker.
everybody. We will post this and we will send out a notice that the recording has finished, and we'll place it on our website. But we'll definitely send all the people who registered a note. And thank you so much. And there was a survey. Did you say, Patrick?
Yeah, that one. I can very
I
quickly.
put the link in there, but I can put it in
Okay.
again. It's the
Yeah.
Salesforce one, right? All
Hmm.
right, I will post it again if everybody could grab it,
Oh,
just
Tracee,
to thank them for their time. Yes, go ahead.
Thank you.
do you have a way can you print this off, or do they have a PowerPoint that lists any more of this information?
I
Um,
believe that we can share a PDF version of this. Let me just circle back and Tracee if we can, which I'm fairly certain we can, I'll send it to you and then you can distribute it.
That will be helpful because there's a part of really, really important stuff that one of you said, and I couldn't get it written that fast, and it was really important. So
Yeah, I think we can. I'm pretty sure we can share this.
thank you very much.
Sure thing.
All right. Have a great day, everyone, and take care.
Thanks, everyone.
Thank you all. Thank you, Tracee.
Bye-bye.
Bye-bye.
You're welcome. Thank you.
Thank you all.